Today, we're diving into some of the most iconic injuries from the Olympic Games over the years. We'll talk about what happened, the severity of the injury, and what it meant for the athlete's recovery as we continue to deepen our knowledge on human anatomy and physiology. Because when the world's top athletes give their maximum effort, what could possibly go wrong?
And as I describe it, I hear a funny pop. And 2 or 3 strides later is then when I felt it.
My ortho senses are tingling. Many still remember Derek Redmond's dramatic race at the 1992 Barcelona Olympics. After winning gold as a member of the British 4x400 meter relay team at the World Championships, Redmond was hoping to add another medal to his collection. Ice, ice, baby. He exploded out of the blocks, running beautifully as he approached the halfway mark. Then, at approximately 150 meters, disaster struck. Redmond felt a sharp pain, grasping for the back of his right leg before slowing down and collapsing on the track. Interns, any guess what injury has occurred? Meet the hamstrings, yo. A group of 3 muscles responsible for flexing the knee, extending the hip, and posteriorly tilting the pelvis. Actions crucial for the mechanics of running. These muscles originate from the ischial tuberosity, also known as the sits bone, on the lower part of your pelvis. That is, right around where Derek is grasping his leg as he limps down the track. And as you can see, further from the hamstring insertion point at the tibia and fibula bones in the lower leg. It's likely the injury occurred closer to the pelvis, where coincidentally, there is higher muscle tension and force generation when running. When sprinting, the force moving through the hamstrings is absolutely immense, sometimes up to 5 to 7 times the body weight. In Derek's case, this could mean upwards of 1,078 pounds. Simply put, sometimes the mechanical forces exceed the capacity of the muscle to tolerate muscle strain. But despite the excruciating pain, Redmond was determined to finish what he started, struggling to his feet before hobbling down the track. Heroic. But let it be known, it is not a good idea to put injured tissue under further strain, especially the hamstrings, which are crucial to far more than just running. If torn completely, you can kiss walking properly goodbye. Thankfully, Derek's father dodged security personnel, made his way onto the track, and put his arm around his son. With Redmond Sr. supporting the injured leg, the duo finished the race, an enduring symbol of perseverance and love. Unfortunately, a standing ovation won't save Derek from the anatomical facts. As I alluded to moments ago, strains often occur at the weakest link in the chain, and/or where mechanical forces are the highest. The musculotendinous junction, or MTJ, where the muscle fibers meet the tendon, is often in the proverbial line of fire, especially in this case. Just look at the size of the hamstrings compared to the tendon that anchors them to the sit bone or ischial tuberosity. Think of a tendon like a strong, flexible rope that connects your muscles to your bones. At the MTJ, the tendon fans outwards, like a fraying rope, as it transitions into muscle fibers. Welcome to the scene of the crime. Strains are categorized into 3 degrees, depending on their severity. Now, this looks to be a fairly serious injury, either grade 2 or above, at least a partial tear in the hamstring. In the case of a grade 2 hamstring strain, we might expect an athlete to return to sport within 4 to 8 weeks, though high-performing athletes with access to top-notch manual therapies can often heal slightly faster. Many strains of this type can be managed non-operatively with, meth.
I'm thinking maybe you and I could partner up.
Whoa, whoa, whoa.
You want to cook crystal meth?
Don't get the wrong idea, interns. This is not meth of the crystal variety. We're talking about movement, elevation, traction, and heat. An acronym who, with the support of recent research, has dethroned the long-toted king of recovery: rest, ice, compression, and elevation. That is to say, the RICE method. But whether you learn RICE or meth, the key to either method is understanding that the body is attempting to address the trauma through the inflammation process.
A hamstring pull is a hamstring pull.
After the race, Derek was definitely hoping for a prognosis treatable through one of the aforementioned protocols. But as we enter grade 3 territory, an athlete is far more likely to find themselves under the knife.
It was me, my dad, and my coach went and saw the surgeon. He basically said these three things to me. Your hamstring shot, your athletics career's over, you're never going to compete for your country again.
When a surgeon tells you your hamstring is shot and there's no chance of returning to your sport, wow, damn. All signs point to grade 3. A severe tear at the musculotendinous junction will be addressed with sutures, effectively reattaching the muscle to the tendon, which anchors it to the bone. Then the recovery process begins. After the surgery, the body needs rest, especially during the acute phase of healing or first few days. Then over the next few weeks, or subacute phase, we can begin to restore motion, gradually reintroduce load, and continue to manage pain and swelling. I'm a big proponent of an active progressive approach to recovery that begins with light, pain-free ranges of motion and slowly reintroduces resistance, typically body weight, before adding poundage. Eventually, the athlete can introduce eccentric training, or lengthening the muscle under tension, which has shown promising results for strain injuries. By strengthening the all-important musculotendinous junction, it helps to improve resilience against future injuries. When it comes to the hamstrings, a hinge exercise is an excellent choice for rehabbing. The hinge lengthens the hamstrings while the body and/or weight lowers towards the ground. As the athlete progresses through their recovery, they can slowly reintroduce their sport into their training, making sure to respect their pain limitations. Though Derek never competed in the 400 again, he did return to sport: professional basketball, motocross, even celebrity gladiators. And hell, crossing that Barcelona finish line alongside his father has to be one of the most heartwarming moments in sport history ever. Our next patient is none other than legendary American gymnast Kerri Strugg. Her story takes place at the 1996 Atlanta Olympics, where Team USA was vying for their first ever team gold medal in women's gymnastics. Kerri's first vault, a difficult Yurchenko with 1.5 twists, ended disastrously, and she sustained damage to her left ankle. When we slow the footage, it looks like her left ankle sustains more of the landing impact than her right. Her foot sinks into the soft mat and obscures our view at the moment of injury. But when she opts for a single leg squat instead of using both legs to stand, it's clear that something is wrong. Despite the pain, Strugg knew the team needed her to perform one more vault to clinch the gold, which she lands on basically one leg. Well, two, but it's clear that her second landing only exacerbated the damage inflicted on her previous fall.
Tell us what the exact injury is. What did you do? Did it break?
They think I hurt some of the ligaments. Maybe there's a partial tear.
It was later revealed that she had torn 2 ligaments in her left ankle, namely the anterior talofibular ligament, or ATFL, and the calcaneofibular ligament, CFL, which provides stability and support to the outside or lateral aspect of the ankle joint, critical in high-impact activities like vaulting. Typically, these ligaments are susceptible to excessive inversion forces at the ankle joint, which doesn't seem to have occurred to any great degree on her second landing. With excessive inversion in mind as our likely mechanism of injury, we gain a greater insight as to how her left ankle might have bent when her foot pressed into the mat on her previous attempt. Though we don't know the full extent of the damage the ATFL and CFL ligaments sustained during her first attempt, I can tell you that high axial load, the force exerted along the length of the bone vertically into her ankle on her second attempt, could easily have finished the job, a 1-2 punch, if you will. You see, the involved ligaments both protect against excessive inversion, but also help stabilize the ankle from front to back, preventing excessive movement through the ankle joint. Every time she lands, the rotational nature of her movement in the air requires a lot of inertia to travel through the bones and joints of Kerri's body, right up through the ankle. Spinning in midair, this line of stress will travel from the center of rotation, Kerri's midline, to her extremities, her arms and legs. Upon landing, the bones of her lower legs and feet stretch apart from one another, while the ligaments do their best to keep the joint in alignment. Stress on these ligaments shoots through the roof when the twist comes to an abrupt stop as she lands on the mat. In a 1996 newspaper clipping from the Orlando Sentinel, Strugg was quoted saying, "I think I broke it," as her coaches and teammates rushed to her aid. Later on, x-rays would fail to find a fracture, but that's not to say Kerri wouldn't have felt a click, pop, or cracking sensation like when a bone breaks.
What were you thinking? You knew you were hurt, you did the first bolt, and you heard a little...
Yeah.
You see, ligaments tasked with holding bones together are relatively inflexible by design. And severe ankle sprain, as described by the USA team doctor following the event, sometimes means ripped off the bone. But what's a couple of ligaments in exchange for a gold medal winning near perfect score? After the second vault, Kerri, very obviously in pain, has to be carried off the mat by her coach. She is soon to discover that ligamentous injuries like tendon injuries are also characterized by degree. A different article in the US Sun explains that she was treated for a third-degree lateral sprain on her left ankle, a clean tear as we suspected, and that she tragically struggled to recover from her injury and retired from gymnastics. Ligaments and tendons are both made from the same kind of connective tissue, and unlike muscles, these structures do not have blood vessels running through them in the same manner as do bones and muscles. As such, their metabolism is about 1/9 to 1/10 compared to that of muscle and even bone, which equates to far lesser healing capability. And that's where I come in. I was unable to find confirmation that Kerri underwent surgery, but I did read that it took her approximately 6 months to return to sport, which is consistent with the recovery process for an athlete following a major reconstructive surgery to the aforementioned ankle ligaments. You may be surprised to learn that surgery, even for a ligament that is completely torn, is not always recommended. As a rule of thumb, if there is persistent instability during daily activities, you're likely to wind up under the knife. If not, then we live and let live, man. Fun fact, I tore the same ligaments during my university football years and never underwent surgery. Mind you, I had my ankle taped before every practice and every game, and then since I stopped playing football, I didn't really require the same level of stability. All the activity I do nowadays is in a straight line, so I manage just fine. With ligament injuries, proprioceptive exercises, those that help the body sense its position in space, are particularly important to prevent future instability. Finally, in the rehabilitation phase, Kerri will gradually work to increase strength and stability with progressive weight-bearing activities and more dynamic exercises to prepare for her extremely high demands of gymnastics. Demands with which our next patient, Samir Aït Saïd, is also very well acquainted. Day 1, 2016 Olympics, Rio de Janeiro. Samir is considered a strong contender for a medal and approaches the vault with laser focus. Yeah, I'm not actually going to show the footage of this injury because YouTube won't like that. But suffice it to say that where the nature of Kerri's injury was unclear, Samir's left tibia and fibula left absolutely no room for doubt. For those of you anatomically inclined, I'll leave a link to the full video in the description box. As Samir landed, his left leg took the brunt of the impact, resulting in an immediate and severe fracture. Together, the tibia and fibula form the lower leg. They are long bones characterized by a slender shaft with 2 ends and longer than they are wide. The tibia is the larger weight-bearing bone, while the fibula is smaller and provides additional support and stability to the ankle and lower leg. And Samir snapped them both pretty much in half.
I hope you hurt yourself. What? I hope you get on that stage and break one of your legs.
Because why do anything if you're not going to do it 100%? But since fractures to the bones of the lower leg are typically associated with rotation and falls from height, I'm not exactly surprised. Samir under-rotates, and on his left side, his big toe is the first to make contact with the mat, driving his left foot, ankle, and subsequently lower leg sharply into external rotation. The entirety of the rotational force sufficient to complete 2 full backflips is focused through his syndesmosis, that is, the ligamentous tissue between the tibia and fibula that holds the 2 bones together. Now, if you've been watching this channel for a long time, you'll know bones are excellent in compression, but they suck in rotation. just like on the shirt there. This is one of the reasons why precision is so critical in vaulting and why any minor miscalculations can lead to serious injury. Though I couldn't find Samir's actual x-ray, it would have looked something like this. Very obvious, clean break with dangerously sharp edges of bone. Thankfully, it does not appear that Samir's bones broke the skin, as can sometimes happen with fractures of this type. And although it will not spare him much pain, he dodged several risk factors, including infections like osteomyelitis or sepsis, as well as hemorrhaging, excessive blood loss, that can stem from open fractures, the term we use to denote that the skin is broken. In fact, the medical team acts quickly to straighten and immobilize Samir's leg with a splint or brace to prevent such potential complications. Because you never really want a couple sharp bone shards poking around inside and then potentially outside the leg for very long. And surely the nearby nerves and blood vessels are happy to be out of harm's way.
How does your leg feel when you land, when you actually hit the ground?
Okay, perfect.
Once on the operating table, we'll realign the bones and stabilize them using surgical hardware, either metal rods, plates, and screws, or an intramedullary nail, which hold the fragments in place while they heal. First, our osteoblasts, little bone-forming cells, deposit layers of collagen and minerals, forming a callus that bridges the gap between the broken bone fragments, later to be replaced by fully formed bone. Samir actually returned to competition at the World Championships the following year. So, as he can attest, bones have a very impressive healing capacity. They are quite rich in blood supply, and therefore the oxygen and nutrients it carries, since blood is literally made in the bone marrow that lives inside of our bones. With adequate rest, immobilization, and medication post-operatively, we can create an environment where the bone, in all its healing glory, can go for the gold.
Okay, I see what you did there.
Over time, Samir will work to restore mobility and then transition into weight-bearing exercises as tolerated. The use of techniques like passive range of motion exercises and isometric strengthening will ensure that surrounding muscles remain active and supportive, while advanced techniques like proprioceptive neurofacilitation or PNF, or even muscle setting may also be used to enhance the healing process. Okay, interns, pop quiz. Name one structure in the body that is over 1.5 feet long in fully grown adults and has zero capacity to regenerate once damaged or severed. If you guessed spinal cord, you're right. And I'm sure by now you know what's coming. I mean, with 400 plus pounds overhead, the slightest slip or muscular failure could easily be, well, bad. Here, Matthias Steiner, at the time the reigning super heavyweight gold medalist, performs the first portion of an incredible snatch, and it looks for a moment like he will complete the lift successfully. And then Matthias loses his balance. And I'm sure you can imagine what comes next. In an instant, the immense weight forces Matthias's neck sharply into flexion, a position associated with whiplash, herniated discs, vertebral fractures, spinal cord injuries, ligament sprains, and facet joint injuries. Okay, so we're off to a horrifying start, but in an incredible stroke of luck, Matthias is also falling backwards as the weight crashes down on top of him, causing his neck to move from forward flexion into lateral flexion and ultimately out from underneath the bar. Infinitely better than if his neck remained under the bar and his body folded in half into the floor. The cervical spine dodge, the worst case scenario. We see medical personnel rush to his aid, fearing injury to the cervical spine and potentially catastrophic damage to the spinal cord. Their primary concern is to stabilize Matthias's neck and prevent further damage, and typically a cervical collar and spine board will be used to this end, unless of course... Did you catch that? Matthias appears to be moving his feet, which would not have been possible had catastrophic damage to the cervical spine and spinal cord occurred. You see, the spinal cord is a bundle of nerves that relays electrical signals from the brain to the rest of the body. An information superhighway, if you will. And when it is severely damaged, a voluntary movement below the level of injury ceases. Imagine the doctor's relief when Matthias shows signs of movements and moments later is able to walk out of the stadium unassisted. A little touch on the back of the neck as if he suffered a mosquito bite. He was still taken to the hospital and thoroughly examined for anything out of place. X-ray, CT scan, MRIs, the whole 9 yards. Thankfully, according to an injury update published by ESPN, tests showed Steiner suffered ligament and muscle injuries in the accident, but no damage to his spine. No surgery was needed. My best guess is that the posterior longitudinal ligament and the spinal erector muscles and the trapezius muscles bore the brunt of the damage. But hey, when the alternative was likely paralysis, we'll sure as hell take it. Of course, interns, before I let you go, we need to talk about one final injury which occurred in dramatic fashion at this year's Paris Olympic Games. Apparently, the dreaded COVID virus struck 200-meter specialist Noah Lyles 2 days before his race. Had Noah won, he would have been crowned the undisputed fastest man in the world with the 100-meter and 200-meter gold to his credit. Of course, a respiratory virus whose symptoms include shortness of breath, fatigue, fever, and muscle aches could easily kibosh a sprinter's performance. I mean, for those of you out there who have had the virus, you know what I mean. Now, Noah's fastest time to date was 19.31 seconds, though he did only run that once. His other notable times hovering between 1944 to 1950, closer to what he ran at this past Olympics. He was uncharacteristically winded after his race, which would be the case for one suffering from a respiratory virus. And although the 200-meter sprint is largely an anaerobic event, meaning that it doesn't require oxygen for energy production, I imagine that it would be impossible for you to complete the event if you were holding your breath. So a respiratory illness would have some kind of undetermined impact on anyone's performance. I don't know. Let me know what you think in the comments down below. Well, interns, if you enjoyed the video, be sure to leave us a comment and give it a big thumbs up to feed the algorithm. And if you're already subscribed, make sure that YouTube didn't unsubscribe you from the channel. We are working towards 700,000 subs, so we don't want to lose any interns along the way. We would love to have you on the journey. If you didn't like the video, be sure to let me know why in the comment section down below. I read as many comments as I can, and we use your feedback to make our videos better for you. And don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.